Hi, everyone, and welcome to Chill Talk English. I'm Henry.
And I'm Emma. Today, we're talking about something important for your health.
Visiting a doctor in a new country can be stressful, especially when you don't speak the language well.
I remember my first doctor's appointment in Canada. I got so confused trying to explain my symptoms.
Oh no, what happened?
I had a headache and fever, but I didn't know how to describe them properly. The doctor looked concerned but couldn't understand me.
I had a similar experience when I traveled to Thailand. I didn't know how to ask for pain medicine.
It can be scary when you don't know what to say to a healthcare professional.
That's why today we're going to help you with essential doctor English phrases.
These phrases will make your medical visits much smoother and less stressful.
So, why should you listen to today's episode? First, you'll feel more confident at the doctor's office.
Second, you'll learn practical phrases that you can use right away.
And third, you'll be ready for real-life conversations with doctors and nurses.
These phrases can help you get the right care in any English-speaking country.
Learning English is like packing a first aid kit, one phrase at a time.
Today, we're adding some important medical phrases to your language first aid kit.
With these phrases, you can go from confused to clear communication about your health. I remember when I was 22, I had a stomachache while traveling in the US. I was so worried.
Oh no! Did you know how to describe your pain to the doctor?
Not really. I just pointed to my stomach and said, ouch, repeatedly. It worked, but it was embarrassing.
That's why learning doctor English is so important, even for young travelers.
Now I can help others who might feel lost at a doctor's appointment.
I had a friend who didn't take her medicine correctly because she didn't understand the doctor's instructions.
Was that difficult for her?
Very. She took the wrong dosage at the wrong times. It made her condition worse.
That's exactly why we're creating this episode today, to help people like her.
Today, we'll cover 4 important medical situations. First, we'll learn phrases for making an appointment.
Second, we'll practice describing symptoms.
Third, we'll learn useful phrases for understanding instructions.
And finally, we'll cover asking questions about treatment.
Each section will have guided response, role plays, a short story, and guided practice.
We'll make it fun and easy so you can use these phrases in real life.
At the end, we have a quick quiz to test what you've learned.
Plus, we'll give you a challenge to practice using these phrases.
Make sure to listen carefully for our quick quiz at the end of the episode. It's a fun way to check how much you've learned.
You might be surprised at how many phrases you remember.
It's like a little game to test your knowledge.
If you enjoyed today's episode, please give us a thumbs up and subscribe to our channel.
That helps more people find Chill Talk English and learn with us.
You can also share this episode with friends who might need to visit a doctor.
Let's get started with our first scene.
Scene 1. Making an appointment. Guided response.
Welcome to our first scene. We're focusing on how to make a doctor's appointment in English.
Let's learn some useful phrases for calling and scheduling an appointment.
First, when you call to make an appointment, you can say,
Hello, I'd like to make an appointment.
or
I need to see a doctor.
they might ask.
What seems to be the problem?
You can say,
I have a headache.
or
I'm feeling sick.
they might ask.
When would you like to come?
You can reply,
Tomorrow would be good.
or
As soon as possible, please.
they might say.
We have an opening at 3 p.m.
You can reply.
That works for me.
Remember to be clear and polite when making appointments.
Excellent. These phrases will help you schedule appointments easily.
Let's move on to some role plays to see how these phrases work in real conversations.
Role play. Now let's practice with a role play. I'll be the patient and Emma will be the receptionist.
Hello, City Medical Clinic. How can I help you?
Hello, I'd like to make an appointment.
Of course. What seems to be the problem?
I have a stomachache.
I'm sorry to hear that. When would you like to come?
Tomorrow would be good.
Let me check our availability. We have an opening at 10 a.m.
That works for me.
Great. Can I have your name and phone number?
Yes, it's John Smith. My number is 555-1234.
Thank you, John. We see you tomorrow at 10 a.m.
Thank you for your help.
You're welcome. See you tomorrow.
Great job with the role plays. Let's move on.
Up next, we have a short story. As you listen, try to notice how the appointment phrases you just learned appear naturally in the story.
Our story today is called Maria's Doctor Visit.
Maria sat nervously at her desk, her hand pressed against her forehead. She had a throbbing headache that wouldn't go away. It was her first time living in an English-speaking country, and she didn't know how to get medical help.
She picked up her phone and took a deep breath. Hello, City Medical Clinic? A friendly voice answered.
Maria's voice trembled slightly. Hello, I'd like to make an appointment.
Of course, the receptionist replied kindly. What seems to be the problem?
I have a headache, Maria said, feeling embarrassed about her limited English.
I'm sorry to hear that, the receptionist said sympathetically. When would you like to come?
As soon as possible, please, Maria replied, hoping they could see her today.
Let me check our availability, the receptionist said. We have an opening at 2 p.m. today.
Maria felt a wave of relief. That works for me, she said, smiling for the first time.
Great, the receptionist confirmed. Can I have your name and phone number?
Yes, it's Maria Garcia. My number is 555-6789, Maria said, writing it down.
Thank you, Maria, the receptionist said warmly. We see you today at 2 p.m.
Thank you for your help, Maria replied, feeling much better already.
As Maria hung up the phone, she felt a sense of accomplishment. She had successfully made her first doctor's appointment in English.
Now she just needed to figure out how to describe her headache when she got there.
Did you hear the phrases, I'd like to make an appointment, what seems to be the problem, and when would you like to come? Try to remember how they were used.
Great listening. Now let's take those same phrases and practice saying them together. It's time for some shadowing practice, where you can repeat the phrases after us.
Shadowing practice. This time, it's your turn. I'll say a phrase, and you repeat after me. Remember to copy my pronunciation and intonation. Try saying it out loud yourself, pausing after you hear each phrase.
Hello, I'd like to make an appointment.
Hello, I'd like to make an appointment.
What seems to be the problem?
What seems to be the problem?
I have a headache.
I have a headache.
When would you like to come?
When would you like to come?
Tomorrow would be good.
Tomorrow would be good.
We have an opening at 3 p.m.
We have an opening at 3 p.m.
That works for me, she said, smiling for the first time.
Thank you for your help.
You're doing great. Try to imagine you're really calling a doctor's office while you practice.
Excellent work. When you practice these phrases, think about a time you needed to see a doctor. It will help you remember them better. Scene 2. Describing symptoms, guided response.
Welcome to our second scene. We're focusing on how to describe your symptoms to a doctor.
Let's learn some useful words for describing how you feel.
First, if you have pain, you can say,
I have a headache.
or
My stomach hurts.
if you feel tired, you can say,
I'm tired.
or I feel weak,
If you have a fever, you can say, I have a fever.
or
I feel hot.
if you feel nauseous, you can say,
I feel sick to my stomach.
or
I want to throw up.
if you have other symptoms, you can say,
I have a cough.
or
My nose is runny.
remember to be specific when describing your symptoms.
Excellent. These words will help you explain how you feel.
Let's move on to some role plays to see how these words work in real conversations.
Role play. Now, let's practice with a role play. I'll be the patient and Emma will be the doctor.
Hello, please come in. What seems to be the problem?
Hello, doctor. I have a headache.
I'm sorry to hear that. How long have you had it?
For 2 days. My stomach hurts too.
Do you feel tired?
Yes, I feel very tired.
Do you have a fever?
Yes, I feel hot.
Do you feel sick to your stomach?
Sometimes I want to throw up.
I see. Do you have a cough?
No, but my nose is runny.
Thank you for telling me about your symptoms.
Thank you for your help.
You're welcome. We'll figure this out together.
Great job with the role plays. Let's move on.
Up next, we have a short story. As you listen, try to notice how the symptom words you just learned appear naturally in the story.
Our story today is called Tom's Sick Day.
Tom woke up feeling terrible. His head throbbed, and his stomach felt like it was doing flips. It was his first day at a new job, and he couldn't possibly go to work like this.
He picked up his phone and called his friend Sarah. I don't feel well, he said weakly into the phone.
Oh no, what's wrong? Sarah asked with concern.
I have a headache, Tom explained, wincing in pain, and my stomach hurts.
That sounds awful, Sarah said sympathetically. How long have you felt like this?
Since yesterday, Tom replied. I feel very tired, too.
Do you have a fever? Sarah asked, thinking of possible causes.
Yes, I feel hot, Tom confirmed, touching his forehead. And sometimes I feel sick to my stomach.
Do you want to throw up? Sarah asked gently.
Not right now, Tom said, taking a deep breath. But I might later. Oh, and I have a cough, too.
That sounds like the flu, Sarah said wisely. You should see a doctor.
I don't know how to explain this in English, Tom admitted, worried about his language skills.
I can help you practice what to say, Sarah offered kindly. Let's go through your symptoms together.
With Sarah's help, Tom felt more confident about calling the doctor. He wrote down his symptoms: headache, stomachache, tiredness, fever, nausea, and cough.
Now you can explain everything clearly, Sarah said with a smile. You're going to be fine.
Tom took a deep breath and dialed the doctor's office. Hello, I'd like to make an appointment, he said, his voice stronger now.
As Tom described his symptoms to the receptionist, he felt a sense of relief. He was taking care of his health, and that was the first step to feeling better.
Did you hear the symptom words headache, stomach hurts, tired, fever, and sick to your stomach? Try to remember how they were used.
Great listening. Now let's take those same symptom words and practice saying them together. It's time for some shadowing practice, where you can repeat the words after us.
Shadowing practice. Your turn. I'll say each word and you copy me. Focus on the rhythm and tone. Pause and speak out loud after each word.
I have a headache.
I have a headache.
My stomach hurts.
My stomach hurts.
I'm tired.
I'm tired.
I feel weak.
I feel weak.
I have a fever.
I have a fever.
I feel hot.
I feel hot.
I feel sick to my stomach.
I want to throw up.
I want to throw up.
I have a cough.
I have a cough.
My nose is runny.
My nose is runny.
You're doing great. Try to imagine how you would feel if you had these symptoms while you practice.
Excellent work. When you practice these words, think about body parts and how they feel. It will help you remember them better.
Scene 3. Understanding instructions. Guided response.
Welcome to our third scene. We're focusing on how to understand a doctor's instructions.
Let's learn some useful phrases for following medical advice.
First, if you don't understand something, you can say,
I'm sorry, I don't understand.
or,
Could you repeat that, please?
if you need clarification, you can say,
What does take it easy mean?
or,
Can you explain that again?
if you need to write something down, you can say,
Can I write this down?
or,
Could you spell that for me?
if you need more time, you can say,
Can I have more time to think?
or,
I need to understand this better.
remember to ask questions if you don't understand something.
Excellent. These phrases will help you follow medical instructions correctly.
Let's move on to some role plays to see how these phrases work in real conversations.
Role play. Now, let's practice with a role play. I'll be the patient and Emma will be the doctor.
You should take this medicine 3 times a day.
I'm sorry, I don't understand.
It means you take the medicine after breakfast, lunch, and dinner.
Oh, I see. Could you repeat that, please?
Take this medicine 3 times a day, after meals.
What does take it easy mean?
It means rest and don't do physical activities.
Can I write this down?
Of course, medicine 3 times a day after meals.
Could you spell that for me?
MEDICINE, 3 times a day.
Thank you for explaining.
You're welcome. Feel better soon.
Great job with the role plays. Let's move on.
Up next, we have a short story. As you listen, try to notice how the instruction phrases you just learned appear naturally in the story.
Our story today is called Lisa's Medicine Mystery.
Lisa sat nervously on the edge of the examination table, her hands clenched in her lap. The doctor had just given her instructions for her medicine, but she was worried she wouldn't remember everything.
You should take this antibiotic twice a day for 7 days, the doctor said kindly.
Lisa's eyes widened. "I'm sorry, I don't understand," she admitted, feeling embarrassed.
It means you take 1 pill in the morning and 1 at night, the doctor explained patiently.
"Oh, I see," Lisa nodded. "Could you repeat that, please?"
Take 1 pill every 12 hours, the doctor said slowly, with food.
"What does take it easy mean?" Lisa asked, confused by this phrase.
It means rest and avoid strenuous activities for a few days, the doctor clarified.
"Can I write this down?" Lisa asked, reaching for her notebook.
Of course, the doctor smiled. Antibiotic, 1 pill twice daily with food.
"Could you spell that for me?" Lisa requested, wanting to be sure.
ANTIBIOTIC, the doctor spelled out slowly, twice daily with food.
"Thank you for explaining," Lisa said, feeling more confident.
You're welcome, the doctor said kindly. Feel better soon.
As Lisa left the clinic, she felt relieved. She had all the information she needed to take her medicine correctly.
That night, she took her first pill with dinner and felt proud of herself for understanding the doctor's instructions.
The next morning, she took her second pill and smiled. She was on the road to recovery.
Did you hear the instruction phrases, "I'm sorry, I don't understand"? Could you repeat that, please? And, "Can I write this down"? Try to remember how they were used.
Great listening! Now, let's take those same instruction phrases and practice saying them together. It's time for some shadowing practice, where you can repeat the phrases after us.
Shadowing practice. Now it's all yours. Copy my words and my intonation. Speak aloud after each phrase, just like in real conversation.
"I'm sorry, I don't understand."
I'm sorry, I don't understand.
Could you repeat that, please?
Could you repeat that, please?
What does take it easy mean?
What does take it easy mean?
Can you explain that again?
Can you explain that again?
Can I write this down?
Can I write this down?
Could you spell that for me?
Could you spell that for me?
Can I have more time to think?
I need to understand this better.
Thank you for explaining.
You're doing great. Try to imagine you're really talking to a doctor while you practice.
Excellent work. When you practice these phrases, think about a time you needed to understand instructions. It will help you remember them better.
Scene 4. Asking questions about treatment. Guided response.
Welcome to our fourth and final scene. We're focusing on how to ask questions about your treatment.
Let's learn some useful phrases for getting information about your healthcare.
First, if you want to know about side effects, you can say,
What are the side effects?
or
Will this medicine make me sleepy?
if you want to know about alternatives, you can say,
Are there other options?
or
Is there a natural remedy?
if you want to know about recovery time, you can say,
How long will it take to get better?
or
When can I go back to work?
if you want to know about follow-up, you can say,
Do I need to come back?
or
When should I see you again?
remember to ask all your questions before leaving the doctor's office.
Excellent. These phrases will help you get all the information you need.
Let's move on to some role plays to see how these phrases work in real conversations.
Role play. Now let's practice with a role play. I'll be the patient and Emma will be the doctor.
I'm prescribing this medicine for your infection.
What are the side effects?
It might make you feel a little dizzy.
Will this medicine make me sleepy?
Not usually, but everyone reacts differently.
Are there other options?
There is another antibiotic, but it's stronger.
Is there a natural remedy?
You can rest and drink lots of fluids too.
How long will it take to get better?
With medicine, you should feel better in a few days.
When can I go back to work?
Tomorrow, if you feel up to it.
Do I need to come back?
Only if you don't feel better in 3 days.
When should I see you again?
Next week for a checkup.
Thank you for all the information.
You're welcome. Feel better soon.
Great job with the role plays. Let's move on.
Up next, we have a short story. As you listen, try to notice how the question phrases you just learned appear naturally in the story.
Our story today is called Carlos's Recovery Journey.
Carlos sat nervously in the doctor's office, clutching his prescription tightly. The doctor had just diagnosed him with a chest infection, and he was worried about the treatment.
I'm prescribing this antibiotic for your infection, the doctor said calmly.
Carlos took a deep breath. "What are the side effects?" he asked, wanting to know what to expect.
It might make you feel a little tired, the doctor explained, but it should help clear up the infection.
"Will this medicine make me sleepy?" Carlos asked, concerned about his work.
Not usually, but everyone reacts differently, the doctor reassured him.
"Are there other options?" Carlos inquired, hoping for something less intense.
There is another antibiotic, but it's stronger, the doctor said thoughtfully. This one should work well for you.
"Is there a natural remedy?" Carlos asked, curious about alternatives.
You can rest and drink lots of fluids too, the doctor suggested. That helps with recovery.
"How long will it take to get better?" Carlos asked, eager to return to his normal life.
With medicine, you should feel better in a few days, the doctor predicted.
"When can I go back to work?" Carlos wanted to know about his schedule.
Tomorrow, if you feel up to it, the doctor advised. Listen to your body.
"Do I need to come back?" Carlos asked about follow-up care.
Only if you don't feel better in 3 days, the doctor explained. Otherwise, next week for a checkup.
"When should I see you again?" Carlos confirmed the appointment.
Next week, the doctor smiled. We'll check your progress then.
As Carlos left the clinic, he felt more informed and hopeful about his recovery.
He had asked all the right questions and understood his treatment plan.
That night, he took his first dose of medicine and felt like he was on the path to wellness.
Did you hear the question phrases, what are the side effects? Are there other options? And how long will it take to get better? Try to remember how they were used.
Great listening. Now, let's take those same question phrases and practice saying them together. It's time for some shadowing practice, where you can repeat the phrases after us.
Shadowing practice. Repeat after me. I'll model each phrase. Pause, then say it with confidence, just like you're speaking to a real person.
What are the side effects?
What are the side effects?
Will this medicine make me sleepy?
Will this medicine make me sleepy?
Are there other options?
Are there other options?
Is there a natural remedy?
Is there a natural remedy?
How long will it take to get better?
How long will it take to get better?
When should I go back to work?
When should I go back to work?
Do I need to come back?
Do I need to come back?
When should I see you again?
When should I see you again?
Thank you for all the information.
Thank you for all the information.
You're doing great. Try to imagine you're really concerned about your health while you practice.
Excellent work. When you practice these phrases, think about what questions you would want to ask a doctor. It will help you remember them better. Now, let's move on to the vocabulary and phrase breakdown. We'll go over some important words and phrases from these scenes.
Appointment, a scheduled time to see a doctor. Example, I have an appointment with Dr. Smith tomorrow.
Symptoms, signs that you are not feeling well. Example, I have several symptoms: headache, fever, and cough.
Instructions, directions on how to take medicine or care for yourself. Example, the doctor gave me instructions for taking my medicine.
Side effects, problems caused by medicine. Example, this medicine might have side effects like dizziness.
Recovery, the process of getting better after an illness. Example, full recovery might take a few weeks.
Now, let's test your understanding with a quick quiz.
We'll ask you some questions about real medical situations. Listen carefully and choose the best answer. Check if your answer is correct with the answers given in the comments section of this video. Ready? Let's start.
Question 1. What do you say when you want to make an appointment? Options. A. I need to see a doctor. B. I feel sick. C. I have a headache. Question 2. How do you describe a symptom of feeling hot? Options. A. I'm cold. B. I have a fever. C. I feel dizzy. Question 3. What phrase do you use when you don't understand the doctor? Options. A. I'm sorry, I don't understand. B. Can you speak louder? C. I need a translator. Question 4. How do you ask about when you can return to work? Options. A. When can I go back to work? B. I need a sick note. C. I miss my job. Question 5. What do you say to ask about follow-up care? Options. A. Do I need to come back? B. I feel better now. C. This medicine works. Great work, everyone! Let's do a quick recap of what we learned in this episode.
Wow, what a helpful journey we've had today. From making appointments to asking questions, we've learned so many useful doctor phrases.
That's right. Now you know how to make appointments, describe symptoms, understand instructions, and ask questions about treatment.
We also practiced role plays, stories, and shadowing so you can use these phrases confidently in real medical situations.
Remember, learning English is like packing a first aid kit, one phrase at a time. And today, we added many important medical phrases to your language first aid kit.
Next time you visit a doctor, you won't feel anxious. You'll know exactly what to say and what to ask.
Thanks for joining us on this episode of Chill Talk English. Keep practicing, stay healthy, and get ready for confident conversations with doctors.
Before we finish, we have a listener challenge for you.
We want you to post a short comment describing a symptom you might have using one phrase you learned today. For example, I have a headache and I feel tired.
It's a great way to practice what you've learned and share with other learners.
Let's quickly recap the key phrases we've learned so far. For making appointments, I'd like to make an appointment, and what seems to be the problem? For describing symptoms, I have a headache, and I feel sick to my stomach. For understanding instructions, I'm sorry, I don't understand, and can you explain that again? For asking questions, what are the side effects, and how long will it take to get better? These phrases will help you communicate effectively with healthcare providers and get the care you need.
Thanks for joining us today on Chill Talk English. We hope you found these doctor conversation phrases helpful.
If you enjoyed this episode, please give us a thumbs up and subscribe to our channel.
You can also share this episode with friends who might need to visit a doctor in English.
Next time, we'll be talking about English for shopping at the market.
Until then, keep practicing your English every day. Remember, small steps lead to big progress.
Goodbye, everyone, and take good care of your health.